Hey everyone, Dr. West doing West Clinic live with about our team. And then we have a patient here. This is my son getting a treatment called UVB therapy. And this is one of the things I think is really important for people to know and understand when it comes to infections, because there's so much fear and worry and doubt and misinformation about what is happening. And there are more things that we can do besides social distancing, washing your hand, wearing a mask, and shelter in place. And here's why. If you help your immune system to be healthy, it's your best protection and defense, because if the COVID-19 virus is as transmissible as they say, what that means is we're all eventually going to be exposed to it. And one of the things that I was reading about was that what's the difference between people that are getting sick and then people that are responding or being asymptomatic is those people have good immune systems. They don't have comorbidities. They don't have risk factors. And so we want to do our very best to reduce risk factors. So we have talked about what you can do for that from a natural perspective. Sleep, getting enough water. If you get water, it's so underrated, but water is so important for lubricating your mucous membranes. One of my favorite books is You're Not Tired, You're Toxic, and Your Body's Many Cries for Water by Dr. Batmanjidi. I think he's an Iranian doctor that was in prison and had just basically water and sunlight and rest, and he was helping all these prisoners in conditions. It's a fantastic book, but water helps with so many different things, sleeping patterns, and then healthy and alive food. So people ask me all the time, what should I eat? Well, you should only eat food that spoils. Just eat it before it spoils. So here we are in our laboratory talking about, hey, how can we help people to be healthy? And again, healthy and alive foods, fruits and vegetables, especially with kids. Anybody that has kids, if you get high levels of vitamin A, there's some studies that show that it reduces the risk factor for pneumonia and upper respiratory infections. Does it mean that it's going to prevent anything against COVID-19 or the coronavirus? It doesn't. But biology is biology, and if we can help our immune systems against other viruses, logic tells us that it's probably going to help against the coronavirus. Luckily, kids aren't in the super high risk category. You know, there's smattering of cases in younger people, but for the most part, they're unaffected, and we want to keep them that way. The other thing is citrus fruits, bell peppers, spinach, and obviously from Idaho, potatoes have vitamin C in them. Natural source vitamin C is the best way to get vitamin C in your system. It helps to protect your body literally against just about everything, every biologic process. I'm recommending to my family and myself approximately 3,000 milligrams of vitamin C every day. If it's not bothering your bowels, you can go up. And so my friend Dr. Levy that wrote a book that's kind of the Bible in the office, it's the vitamin C Bible called Curing the Incurable, talks about getting enough vitamin C inside of your system so that your bowels start to basically get loose. And that means you're at saturation. So vitamin C to bowel tolerance, but at least 3,000 milligrams. The best source is your knife and fork. Liposomal vitamin C is really good. We have a couple different vitamin C products. Just get vitamin C in your system. There's no downside to this. And it helps with so many different things. Connective tissue, immune system, helps with hormones and neurotransmitters in my clinical experience. Also want to make sure that you've got zinc in your system because it activates some of the coenzymes and some of the immune system processes that go along with vitamin C. And then also we want to make sure we have a little bit of copper. You don't need a lot, and copper is one of the things you have to be really careful of. Too much is bad. Too little is bad, so you want to have it balanced. It's kind of the same thing with iron. One of the most common reasons why people go to doctors is because they are tired. And one of the biggest causes is anemia, iron deficiency anemia. You want to make sure you get a healthy type of iron in their system. But at the same time, iron can be toxic. If you get too much, it's bad and it causes healthcare problems too. So what you're looking at right here is some studies that we've put together and some handouts and some other things that are really important, and also my laboratory, because what this is a special way to get oxygen in your system. This is an ozone generator, and I really encourage people to have this as a consideration in your house, because one of the things that can happen is it's so effective in so many different healthcare conditions. It's good for stomach problems. This is a ozonated water right here that you can drink. It doesn't taste very good, but I've seen it help a lot of stomach conditions. There's a way that you can have this little stethoscope thing where you can put it here, and you can go, basically we call it ear insufflation, and then there's also a rectal insufflation possibility. This is what the units look like, and so there's just an amazing way that you can help your body to get extra oxygen, and why this is important. I love this study from one of my heroes, Dr. Rowan. A big shout out. I took some training with him years ago, and he wrote up a study saying, or a hypothesis, a plausible Pentecosting effective treatment for coronavirus. So it's his hypothesis of why the coronavirus cannot handle oxidation, and how it literally helps to, kind of cut off the fingers. It's in the study. I'm going to post a YouTube to his explanation of what's happening and why he advises all of his patients there in California to get ozone therapy. And so there's a couple units that are available. They're not really that expensive for patients. And so if you're interested in one of those units, let me help you out. If you have access to other ozone therapies, great. You should make sure that you download this guide right here. So this says the definitive guide to ozone therapy at home. And it kind of goes back to Otto Warburg. It's something called the Warburg effect. If you've got extra oxygen, or you can get more oxygen in the system, he believed that it was really significant for the treatment and the prevention of cancer. Obviously, we're not talking about a cancer pandemic right now. We're talking about an infectious disease pandemic. And what a neat guide that talks about what if you could find an effective, non-toxic therapy and get free from sickness. Dr. Marcola says in here, ozone therapy is a powerful intervention. Some cautions is it's not something that you want to breathe. It's not something that you turn on. It will irritate your lung tissue. But look at some of the neat effects that it has. Ozone therapy has antioxidant therapy. It improves circulation. It helps with pain. It improves tissue oxygenation. It improves metabolism. Anti-inflammatories, thought to slow down aging, is really good for bacteria, viruses, and fungus. And it's not just me saying this. Like, this isn't an hypothesis that I came up with just lately. It's something that we've seen in the office repeatedly over the last 15 years. I got some ozone education in 2005, and we've continued. And you can see all of the people that we've helped on our blog at dailydosevitaminh.com of things like Epstein-Barr, shingles. It really helps with shingles, chronic fatigue, fibromyalgia, just tons and tons of things. It's not a guess anymore. Like, I've seen this work on thousands of patients. And so if we have something like this inside of your home, I just think it gives you an extra resource or an extra protection layer besides just the social distancing. And when I say just the social distancing, like, I get it. We want to flatten out the curve. We want to make it so that people, are less sick or less sick all at once. But there's so many more things that we can do besides washing your hands, which helps to dissolve the basically lipid or grease layer around the virus. Social distancing, then they're saying the virus can be anywhere from 6 to 24 feet, and it can last anywhere from 1 to 3, like it can be suspended. And then also masks. They're asking people to wear masks, and also to clean surfaces. And the clean surfaces with either isopropyl alcohol or a bleach solution, 70% isopropyl alcohol or a bleach solution. So going back to what we're doing here, this is one of my favorite people and patients. This is my son, Dalton. Dalton has been gracious enough to donate his body to science. And he's going through a treatment right now called ultraviolet blood irradiation therapy. And just so everybody knows, it's actually in our handouts. It's called The Cure That Time Forgot. There's another research packet that we put in there, so here it is. The Cure That Time Forgot, written by one of my heroes, Dr. Rowan. There's also another thing in there, Doctor's UBI Therapy, by another friend of mine, someone I respect, Tom Lowe, has put together some information on it. And what this therapy does is you start an IV treatment, and then what you do is you pull blood out, you put it into a bag of saline, you put some special gamma ozone and oxygen combination you can see it'll go from like purple to red, and then you run it past an ultraviolet chamber back into the body. Now, what's amazing about that therapy is in the article it says this was basically put together in the 1940s in Germany. It appeared in the medical literature for a novel treatment for infections. The treatment had a cure rate of nearly 100% in early and moderately advanced infections and 50% in terminal infections. Healing was not just limited to bacterial infections, but also viral infections like polio, wounds, asthma, arthritis. The German literature has demonstrated profound improvements on biochemistry markers and hematologic markers. There's never been any reported toxicity or side effects except for an occasional healing crisis, or what they call a Herxheimer. So this is something that we've done for patients for 15 years with really good outcomes for viral infections. Again, shingles is one that we treat routinely. Epstein-Barr, we see that herpes simplex 1 or the cold sore virus. You see it in cytomegalovirus and the rhinovirus and rotavirus. So common colds and flus. And if you see what's on our patient testimonial site, daily dose vitamin H, you can see almost all of those people have been through a therapy like this with literally no side effects. Now, looking at the different ways to get in your system, we talked about the ears. We talked about there's a way that you can basically get almost like an oxygen enema. There's a way that you can get it into the body using ozonated oxygen. There's different home units that are available. I urge you to get educated on those. We have just a couple units left for our patients, so I can get you information if that's the direction that you'd like to go. But literally, I believe that if you have this available, that if there is an infection, at least you have another option for a way to get oxygen in your system, and maybe it can be a defining moment in helping someone to avoid a hospital visit. That's certainly been my clinical experience, and in my opinion, this is one of the neatest things that I can tell people about. So we have the definitive guide for ozone therapy at home that's available. We have some units that are available here. There's a hypothesis of why it may work for different types of viral infections. There's a study here called The Cure That Time Forgot. And also, this is kind of fun. There is a researcher in Cuba named Silvia Menendez that's put together a packet here called Ozone in Medicine. And there's also a book. This is just a cover of the book. I lent it out to a patient 2 days ago because they wanted to know more about it. It's called Ozone, the new medical drug. But there's a lot of research available on things like, basically ozone changes the blood stasis in cardiac angina. Ozone helps us in chronic nephritis insufficiency. Ozone therapy is helpful. Okay, so we're talking about ozone therapy in medicine. A lot of research out there. When you are aware of additional tool sets, vitamin A, 10,000 units. Vitamin D, 10,000 units. If you get sick, I would bump those up to 20, 30,000 units of vitamin A, vitamin D, 3,000 to 6,000 units of vitamin C. There's an amazing herb, if you can find it, it's almost impossible to find right now, called lomatium. And it's something that we have in the office. Everybody is starting to recognize how powerful it is. It's hard to get a hold of. My friend at Barlow Herbs, Jane Barlow, has an amazing immune system support program. So lomatium, if you can get a hold of it, echinacea, golden seal, andrographis, astragalus, shiitake mushrooms, maitake mushrooms, these things that help to upregulate your immune system are not being talked about in medicine, not because they're not effective clinically, but because you can't patent natural things, and it's difficult for traditional medicine or big pharma to make money in those, and so they just get neglected. And so we have the DSHEA Act, which is the Dietary Supplement Health Education Act, that protects those natural things for use. And that act, in all honesty, cuts both ways, because sometimes people are putting echinacea root on the market and saying that that's echinacea, and it doesn't have the effect that an echinacea flower does. And so we want to make sure that you have good products. And so if you need a product, like DM me and reach out, and let's figure out how we can get you good stuff. If you have good stuff in your office, then what we need to do is we need to get it inside of of your body. It doesn't work by osmosis. Now, if you'd like the research packets, it's free. Just make sure that you join our private group, Healthness to Wellness. We did one yesterday on Facebook Live, and I talked about why I'm not worried about the coronavirus, and you shouldn't be either. And maybe that's not the right way to say it. Why I'm less concerned about the coronavirus, because we need to take the opportunity now with the social distancing and shelter at home to get your immune system working. And so there are things that will really help with that. Another thing that we didn't talk about yesterday that's really important, that we're putting in the research packet information in our Facebook group. And again, it's free to join. It's Healthness to Wellness. You can hashtag it. We'll give you a free opportunity to put it in the group. We put a whole bunch of studies and information in there, is how vitamin B6 gets vitamin C to work better. It recirculates. Rutin factor, or what they call vitamin P, does the same thing. So these are cofactors that are in foods that are really healthy. So if your food is healthy and alive, you're going to have a tool set of people that aren't eating as healthy, and maybe that's why they're having more healthcare concerns. So healthy and alive food, water, sleep, vitamin A, vitamin C, vitamin D. I mean, I sound a little bit like a broken record, but I've seen it work for 20 years. And it's not just me saying it. There's hundreds of testimonials of people. The office has actually been going for over 100 years, and it's stuff that we've learned inside the trenches. So, to summarize what's happening on this Facebook Live, number one, there are things that we can do to help our body, water, the vitamins we talked about. There's some at-home therapies that are available to the consumers, and I just want everybody to be aware of this. The definitive guide to ozone therapy at home. If you are not aware of this, at least get educated on it. And yes, you can find whatever information on any topic on the internet that's good and that's bad, but at least be aware of it so that you can make up your mind and you can recognize, yes, it's something that I want to evaluate and understand, or no, that's not for me. It's helped a lot of people. I'm not giving this as guinea pigs. There's 15 years of clinical experience on it. Also wanted to make people aware of the different healthcare things that are making a difference for immune system, for other conditions. Again, vitamin C, it's one of my favorite vitamins. It's really, really underrated for the healing effects. And if you look at some of the studies coming out of Milwaukee, University of Milwaukee and Madison, Texas, Houston, Texas is putting vitamin C inside the hospital system. New York is doing 1,500 milligrams every 6 hours and seeing some really good outcomes. Imagine if you did what Dr. Levy recommends in his book, Curing the Incurable, and did 25,000 milligrams, which is something that we routinely do. And then be aware of stuff like this, the ultraviolet therapy. The Cure That Time Forgot is penned by Dr. Rowan, and also Tom Lowe wrote a workup on it called Doctor's UVBI Therapy. And then, of course, the ozonated system. You can get ozonated water that you can drink. You can get it in different systems. There's some home units available. Be aware of those. And it's really important for you to understand ozone therapy. This is my Facebook Live, April 7th, 2020. We're talking about why I'm less concerned about the virus, not arrogant or egotistical. And I've had a couple of people that contacted me yesterday and said, hey, it would be all different if it was one of your inner circle that had the infection. And the answer is, look, I get it, but we also aren't aware of all the tools that are available to work on infections outside of just the social distancing and washing your hands. This is Dr. West. I'll see you guys on the next video, live video. See you later.